MDOC Quality Network, through which we do trainings, through which we support individuals to learn and to build the capacity of the healthcare workers that provide services for our members and others. And then we have our physical nudge hubs. So these are located in communities where individuals can walk in and speak to a health coach and also learn how to use our app. Please go to the next slide. So we have a very short video for you. This is to enable you know how to register on the Complete Health app if you haven't. Please go ahead and play the video. Thank you.
This video is a brief walkthrough through our Complete Health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MDOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the program to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Thank you so much. So that's just a quick and easy way to sign up.
This video is a brief walkthrough through our
quick and easy way to sign up to the Complete Health app. Okay, so for today's agenda, we're going to start off very quickly with getting to know you. I know some of us have been sending in our introductions in the chat, and then we'll just take a few minutes to play a quick game. We'll speak about MDOC and oncology. We would hear messages from some of our champions. We would also hear a message from Dr. Timothy Adebowale. And then we will continue with some of the gifts and celebrations. So please, it's a packed session. And then so we're going to go in very quickly. We're getting to know you. Now, this is going to take a different turn. Sammy, can you put yourself on mute? I keep hearing a notification sound, so I don't know where that is coming from, so that it doesn't distract other people on the call. Thank you. So we're going to have a small, I think I'll call it a game, a mini game, but I need your videos to be on so that we can feel like we're all in the same room. It's getting to know you. So if we can go to the next slide. We want to know you, but we want to know you from a different standpoint. And what that means is, please, next slide. How many of us have seen this movie before? By show of hands, how many of us have seen the movie A Tribe Called Judah? Aha, I see Mrs. Wurala has seen the movie. Okay, Blessing, Raji, who else? Great. So, okay, a number of us have seen the movie. For those of us who have not, this movie is the highest, at least till now, the highest grossing Nigerian movie. They hit ₦1 billion in the cinemas. So it's interesting that we can brag about that now. However, we want to know you based on the different characters in this movie for as many of you as have seen the movie before. So this is how we're going to be introducing ourselves. I'm going to give you an example. It says, which of these characters are based on your favorite food? To be honest with you, my favorite food is not here, but I'm going to go with the next best thing on here. And so the first is, Sammy, I think we are not seeing the bottom part of the slides very well. So if you want to adjust the settings so that it's clearer. But I'm going to introduce myself. Yes, thank you so much, Sammy. So I'm going to introduce myself. Let's see, what's the next best thing? Okay, so hi, my name is Adora, and my favorite food is fried rice and turkey. So we're introducing ourselves by our favorite food. So I am number 2, fried rice and turkey. It would be great to know what other people's introductions are. So if you want to, you can raise your hand if you want to speak, or you can put it in the chat. Number 5, beans. Yes, I'm not surprised, Lisa. Beans and Dodo is Lisa. So Lisa is number 5. I think that was the last child of Mrs. Judah in the movie. Who else? Someone says 3. Number 3. So when you say the number, please tell us what number 3 is. Okay, so hi, I'm Amala Newedu. Okay. Okay. Chiagoze, please feel free to unmute and speak and introduce yourself.
Hi, everyone. Good afternoon. So number 6, yam and eggs.
Just to give you guys a snippet, I have met Chiagoze multiple times, and Chiagoze has a scheduled time every week for yam and eggs, just so you know. Okay, who else wants to introduce themselves? Number 6.
I think I can go next. Hi, everyone.
Go ahead.
My name is Kolawole Akinjela, and yeah, like Chiagoze, I'm also number 6.
Interesting. There are many people that like yam and eggs. Who else? There's another yam and egg here. Titi, jollof rice and chicken, Adeomi. I want to hear from other people. Sheyi is beans and dodo. Rice and beans, Emmanuel. Where is there rice and beans here? Emmanuel has made up his own. Oh. Emmanuel, you have to pick the next best thing here. Mrs. Wural, I know you've seen the movie. Which of them is your how would you introduce yourself? Ma, are you able to unmute yourself so that we can hear you?
Yeah, number 5, beans and dodo.
Okay. It's a tie between beans and dodo and yam and egg gango. Who is going to break this tie? Those of us that like rice, we are not even making it. Does anybody else want to introduce themselves? I see, beans and dodo is, okay, there's jollof rice and chicken, Adebukola, Amala Newedu, Emmanuel, okay. Oh, someone likes goat meat pepper soup. I actually do, but maybe not as much as calling it my favorite. Oh, so okay, well done, Mary. All right, thanks everyone for the introduction. Please keep the introductions coming based on your favorite food. Amala must win. I think it's yam and eggs, actually. It's looking like it's between yam and eggs and beans and dodo. So, sorry, Amala gang. I think the only 2 people I've seen here with Amala. And then like 3 people with rice. So, sorry. So the yam, I think yam and egg has it. And very closely behind yam and egg is beans and dodo. Okay, thank you, everyone. So we're going to quickly play a few games. Now, I came with gifts. So if you want to win gifts, you have to be active here. You might need your video for this because I need to be able to confirm when you say you've won. I need to be able to confirm that indeed you are the winner so that we don't give your gift to somebody else. So please, as much as you can, if you can put on your video, that would be appreciated. Okay, so we're going to start, first of all, with a scavenger hunt. Can we go to the next slide, please? We're going to start with a scavenger hunt. And what that means is I'm going to be calling out a few things. And if you're able to find those things and bring it back and show me on the screen that you have those things, then you stand a chance to win a gift. So, are we ready? I need to see thumbs up if we're ready so that nobody will say we started without them. Please put your thumbs up. Lisa, please, if you are a health coach here under oncology, I do not believe, well, okay, no, let me not limit it. I'll let you. But I doubt that I'll give any of you prizes. Okay, so are we ready? Can we kick off? I'm not seeing the thumbs up. Oh. If you need a minute, just say give me a minute so that we make sure everyone is ready. Okay, I see thumbs up. I don't know why Lisa is crying. Okay, I see a few people are ready. All right, so let's start with the first one. Can you get me a black shoe? A black shoe. It doesn't matter who has the shoe, just get a black shoe and come. Lisa, I'm going to disqualify you. Okay, so there's Lisa, there is Blessing. Who else? A black shoe. You have to show me on the screen, oh. I think I see Mr. Olajide. Yes, Mr. Olajide has a black shoe. Okay, so Mary and Faith, you're supposed to be helping me here to look at the winners. So yes, Mr. Olajide has a black shoe. Okay, wonderful. So by veto power, Mr. Olajide has this one. So number 2. A torchlight. We know everybody knows what's happening with Zinepa now. I don't know what they are called. PHCN. Blessing, is that Mr. Olajide? Blessing, I don't know what that is. Is that a torchlight? Elizabeth. Okay, so I see Mr. Olajide and Elizabeth. Okay. Please feel free to turn on your video. Okay, I see TT as well. Okay. I think we can go to number 3. Something that starts with the letter C. Lisa, what is that? A mug. It starts with the letter M. Adeomi, what is that? Lotion. That's an L. Okay.
It's cream.
I see Jesu. I see I saw someone now. I saw Jesu. Jesu Tufumi had, yes, I see Jesu Tufumi. Yes, okay, fine. So Elizabeth. Oh, I see. Mr. Olajide is on a roll, though. I see him. He has a comb. He's very clear. There's no confusion there. Blessing has a charger. Okay. And then Jesu Tufumi has a cup as well as Elizabeth. Adeomi, that your cream. I'm trying to see how I'm going to let it pass. Okay, Mary, I hope you're keeping score, please. So that, I see Mrs. Wurola has chain as well. Okay, all right, so let's go to the next one, number 4. A piece of fruit. We're all about healthy living. So who has fruit in their house? Let's see all the people that have been listening to their health coach. How many of us have been listening to our health coaches? Today we'll know. Okay, Lisa. Yeah. Oh, sorry, Lisa. Someone beat you to it. Jesu Tufumi has an apple, actually. She got back before you. Sorry. She has an apple. You were busy thinking. I saw you were thinking if you had a fruit in your house. Okay. Okay, great. Let's go to the next one. Who has 10 naira notes? 10 naira notes. Don't worry, whether the old one or the new one. Who has a 10 naira note? This is a tough one, but let's see. Just random 10 naira somewhere. Oh, I see Titi. Titi has a 10 naira note. Anyone else? Anyone wants to sorry?
Wuraola has 10.
Has 10 naira. Oh, okay. So Mary, please, can you put that down as well? Please put that down as well. Okay, great. So I hope we're collating so that we will be able to get our winners by the end of the set of the meeting today. Okay, so next one quickly. A belt. Who has a who has a belt? I see Lisa. A belt. I need at least 2 more people.
Mrs. Wuraola has a belt.
I see. Okay, Mrs. Wuraola has a belt, and Mr. Lajide has a belt as well. Okay. Okay, that's great. Let's go to the next one. A bunch of keys. Does anyone have a bunch of keys? Okay, I see Adeomi. Adeomi was first. I see Lisa. I see Taiwo. Olabode has keys, and Emmanuel Olajide. Yes, so these 4 people. Oh, Jesu Tofumi too has keys. I see Babajide Modupe has keys as well. Okay, so this one was pretty easy. So for those who are collating, we have Taiwo Olabode, we have Babajide Modupe, we have Emmanuel Olajide, Adeomi, and Lisa. Okay. Next one, please. Oh, Mrs. Wuraola as well. Who has vitamins? So whether it's vitamin C or anyone, whether it's in a sachet, it's in a container, let's see. All the people living healthy. Oh, somebody is bringing something. Oh, Jesu Tofumi, yes, she's showing us the bottle. Yes, that's one. Olajide Aina. Oh, sorry. Titi has vitamins. Taiwo is showing us vitamins as well. And Mr. Olajide. Oh, Mr. Olajide has his entire bottle. Well done.
Mrs. Wuraola as well.
Sorry, say that again.
Mrs. Wuraola as well.
I can't see Mrs. Wuraola on my screen. I don't know. Is her video on? I'm not able to see her on my screen.
Yeah, video is on.
Oh, yes,
yeah,
I see her. I see her now.
Yes, it is.
Yes, I see her now. Well done. Okay, so number 9. An ATM card. Mrs. Wuraola, sharp. I've seen Mrs. Wuraola. I see Elizabeth. I see Lisa. I see Mrs. Wuraola. Don't show us the number on your card, though, please. Oh. Just flash it and take it away. Okay, I see Mr. Olajide as well, and Jesu Tofumi as well. Okay, and then the last but not the least, number 10. A phone with the MDoc app downloaded. If you are working in MDoc, you are disqualified from this particular one. So this is for anybody. Elizabeth, will you remove that phone from the screen now? If you have a phone that has the MDoc app, let us see. Let us see. Who has the phone with the MDoc app? Anyone? If we don't have the phone, I'm going to pause this meeting. No, everybody needs to download the MDoc Complete Health app or be on the MDoc Complete Health web platform. So is there any phone that has it? Oh, you might not be able to show it. Okay, that's fine. But okay, if you even know about the app, can you raise your hand if you know about the MDoc Complete Health app? Okay, so Mrs. Worola. Okay, I see Mr. Olajide as well. All right, that's great. So yes, I agree, Chinelo. Some people are using the phone that they have the app on at the moment, so that's fine. But if you haven't downloaded the app, we will support you to download it by the end of the meeting today. So round of applause to everyone who played the game. We're going to collate the numbers, and we do have gifts. So I wasn't joking when I said we had gifts. We do have gifts. Well done. So let's go to the next slide quickly. So what is today about? This is National Cancer Survivors Day. It's a day that's been pretty much set aside every year to celebrate individuals who have gone through this journey. But in addition to that, to inspire and also encourage those who are going through this journey, their caregivers or families that support them, or even the community that provides support to them, the healthcare workers as well. And as MDoc, we are committed to continuing to celebrate our champions and to also remind them that we are solidly behind them through this journey. It's a commitment that we have made and we do not take for granted or take lightly. We're intentional about providing that support for as many of you who are part of our community. I know that you've spoken to our health coaches, you've been receiving support from our health coaches at one point or the other. And we're committed to continuing to provide that support. Just know that even when it gets tough, you're not alone. You have us with you. A lot of us here have lived experiences about this journey as well. And so it's from that place of commitment that we are saying we're going to continue to support you. Okay, so without wasting so much of our time, we will go to the next slide very quickly, where we will be talking about MDoc and oncology. So when I say this support, the self-care support we provide, it is basically some of these things that you're seeing on the screen and some that you have also experienced firsthand. So I will be handing over the mic to Dr. Kolawole Akinjola to walk us through MDoc and oncology. Kola, over to you.
Thank you so much, Dara. Thank you, everyone, for joining us today. It's a pleasure to have you all with us here today. Like Adara said, this is something that we take very personally because we understand the value of the support that we provide to each and every individual on this journey, and we don't take it lightly at all. So speaking about our work in oncology, again, at MDoc, just introduce what we do for those of us who, maybe joining us for the very first time. We are a digital health company that provides end-to-end self-care support for individuals who are going through, their own personal healthcare journey. And we do this, of course, leveraging our technology platform. Like you've been hearing Complete Health since morning. I know some of you have also been on the platform. You've been tracking your healthcare journey, which is fantastic. And then, of course, with that, you have access to health coaches. So all this is what is brought into the support that we provide for people who are living with cancer. Now, for MDoc and oncology, the framework is putting the member at the center of it all. So to us, you are not a patient. To us, you are a member because we are on this journey with you to ensure that you are victorious at the end of the day with you and with your loved ones. And what we do is essentially around, first of all, providing health education on positive lifestyle modifications for you, right? So educating you around the disease, educating you around providing knowledge to you around, what to know, what the disease is about, the medication that you are using, what to eat, around nutrition support, around fitness support, around mental health support. Because again, we understand that all these the disease itself has impact on these aspects of your life. So we are looking at you holistically as an individual and not the journeys and not the journey you are going through alone. So every aspect of your health is being catered for, is being addressed. Every question that you have a health coach that is dedicated to you 24/7. Ask a question, get responses to it. You have access to a nutritionist as well, who provides dietary counseling to you as well. You have access to a mental health coach who is able to provide emotional wellness support, not just to you, but also to your loved ones. Because again, we've seen that the caregivers, the loved ones, are often neglected in this journey, but they're very, very key aspects of people coming out victorious at the end of the day. So we also provide support to them, their mental health, and also you're able to track your journey on our platform, Complete Health. So whatever investigation that you're doing, you're able to personally track them, see how you're doing, and you're going back to your doctor with much more robust information. You can have a very deep conversation with your doctor to understand your healthcare a lot more. But beyond that, beyond all this support that we provide, we also collaborate with your managing physicians. We understand that this journey it involves a network of care for you. So not just the fact that we care for you and your care and the caregivers providing support for you, we also collaborate with your managing physicians, to also let them know the updates on your care. So we know, in Nigeria, it's something that is seen everywhere. There's fragmented care. There is burnout, there's Japa syndrome here and there, but we don't want our members to suffer the brunt of this. So what we do is to collaborate with the managing physician per time, providing regular updates with them, with you at the center of all this, right? And then beyond that, even when there is any crisis, any issue at any point in time, you have a companion with you on your care journey that you can reach out to, a health coach, someone with you, someone in your corner, right, that is with you on this journey. So this is the summary of what we provide. But also beyond this, part of our work has extended to now even involving supporting access to medications via partnerships. So we've been able to secure partnerships with global organizations that have been with us on a journey for a long time, helping us, with access to medications for people that we're supporting, and a lot of other works now extending to the national level with the cancer access partnership and a whole other things happening. So again, this is a journey that we've started now, I think, going to 4 or 5 years. And it's been a journey that's been pleasurable for us as a company. It's been a journey that we've seen the impact in the lives of those that we're supporting. And then what is told us is, when we long for life without difficulties, it reminds us that the oaks grow strong, and when there is strong winds, right? And diamonds are made under pressure. And that is what we preach to our members, that whatever the journey is, whatever the challenges that you're going through, you have a health companion with you on this journey. And again, we're not saying it's going to be easy, but we are saying that at the end of it all, you are going to be victorious. So that is the message that we are preaching, putting you at the center for MDoc and oncology. So thank you, everyone. I'll hand over the mic back to Adora at this point. Thanks, everyone.
Thank you so much, Dr. Kola. Yes, we would like, if you have any questions, if you want more information, we're happy to reach you. So please just send a quick message to us. I will respond very quickly. Next slide, please. Okay, so we're going to go in very quickly into a talk by one of our very seasoned, and I'm stressing that word very well, one of our very seasoned professionals. He has a wealth of experience and many years of expertise within this field. As we all know, today in Nigeria, things are not exactly how it has been before, just because there are many things that have been happening across the economy, and directly or indirectly, these things have a way of possibly affecting us and our mental health. But we want to make sure that in these times and in these seasons, both in Nigeria and in the world at large, I'm sure many of us know what's happening in Ukraine, what is happening with Gaza and the rest. So with the many things that we're hearing every day, we turn on our television and the things that we're dealing with in life. There is always the possibility of these things taking a toll on our mental and emotional health. And so we have a specialist here who has done this for many years, who is very vast in the research around this, to speak to us briefly around mental health support for individuals with serious medical conditions. So please, with a round of applause. I want to see the round of applause in the chat. For those that can clap, please do so. For those that can send a round of applause in the chat. If you don't clap, I will not let him talk. So please, with a round of applause, I would like us to kindly welcome Dr. Timothy Olaolu Adebowale. Over to you, sir. I will prompt you when you have 10 minutes to go and when you have 5 minutes to go, so that we can use the time well. Well done, sir. Please go ahead.
Very much. Everyone, I hope we are all hearing me. Am I?
Yes.
Yes, sir.
Loud and clear.
I suppose. Thank you very much for having me. I want to commend MDoc for this wonderful digital connection that you are giving every one of us together. And it's really a commendable job you are doing. Without wasting our time, let me go straight to what we are going to talk about today. We are talking about mental health support for individuals with serious medical conditions. So the question is, why? What's the link between medical conditions, physical conditions, and mental health? I mean, really, we do know that many people will at some time have a serious physical illness. This is not wishing anyone ill health, but that is the reality of life. And we know that both the illness and the treatment for the illness, for any medical condition, do have implications on the mental health. When we say mental health, what are we talking about? The way we feel, the way we think, and the way we behave. And so all this put together, so that connection is there, there's the body-mind connections. And with this connection, if illness, any illness for that matter, will affect our thinking, our feeling, our behavior, we know that those changes have implications, even not only for the...
Sorry, sir. Sorry, sir, you're sounding slightly far, so the volume is a bit low.
Okay. So do I put maybe stop the video so that we can have good volume then?
Okay, that's fine. Let's try that. It's clear, it's just a bit low.
Okay, okay. Okay, I'll bring the mic close to my mouth first.
Okay,
so
sir.
Okay, so what we're saying is that there is connection between the physical health and mental health. And that is, we can understand that no one that feels ill physically, either with headache or pains in the leg, feels okay. I mean, we feel pain all over the body, and then we feel sad, we are not happy about the condition. So that's a straightaway connection we can put together. But then when illness, any form of illness, affects the way we think and feel, this has implication on how we engage for the treatment and also the outcome of the illness, the outcome of the treatment. So if it affects how we engage, we are going to go into all this. So this talk practically will cover the issue of mental health impact of having a serious physical illness. And then we're also going to look at why are there mental health issues more likely to develop because of physical illness. And then we'll be looking at when should we seek help. And then we'll also try to look at the prevalence. What's the distribution of mental health issues? What type of mental health issues might we have when we have physical health conditions? And then we'll look at how to help ourselves, and then how families and friends can help us. So that's in terms of the outline of this talk. So the next slide. So as I've mentioned, let's go to the next slide, please. Mental health has impact on serious, there are impact of serious physical illness on mental health. Any serious physical illness can affect every area of our life, and why is this so? It can affect our feeling, as I mentioned earlier. It can affect our relationships. Even our belief system is affected, and we start thinking differently. Oh, why me? Have I been taken? I mean, have I sinned? And all sort of issues about belief system is also affected. It affects our work, and then how we socialize with other people. And why should this happen? It may be because we start feeling helpless because of condition, or we feel out of control of our situation generally, or sometimes it may be because of the loneliness sort of that, that illness has imposed upon us. And then sometimes it's because we find it difficult to talk to other people about the condition, even those who are close to us. Sometimes we feel, don't let me bother them with their problems. They also have their problems. So all these issues put together are some of the reasons why there's this connection between serious physical illness and mental health. Beyond that, next slide, please. Let's just quickly look at what's the prevalence and pattern of mental health problems among people. Now, I want to be specific. People with diagnosis of cancer. Research have shown us that the prevalence of depression and anxiety is not a question of just feeling sad, but we are talking about depression as a syndrome, as an illness. And then anxiety as a diagnosis could be as high as 20%. That's for depression, and as high as 10% for anxiety among people with cancer diagnosis. And at various phases and stages of the illness. This is what research has found. And then when we look at all mental health problems generally, beyond anxiety and depression, statistics, research have shown close to 40%, about 40% of people with diagnosis of cancer conditions who have some diagnosable mental health disorder. And this is really the reality all over the world. And this has implication on the quality of life, and also it will also increase healthcare costs for the individuals. So it's also been shown that people with diagnosis of cancer have 20% higher, prevalence of suicide than people without. And sometimes we say, oh, suicide, don't let's talk about it. No, we need to talk about it. Talking about suicide does not increase the rate of suicide, but it actually bring out our sensitivity. We are sensitized, and then we can also now really be able to help people. And especially within the 6 months following diagnosis, that's what research has found. So those are the period of vulnerability, 6 months within diagnosis. People should pay attention to their mental health to prevent such catastrophic incidents. And a recent comprehensive analysis from over 183 studies all over the world in the last 20 years have shown that even the incidence, the prevalence of depression is going up. I said the previous study tells us we could have up to 20%, but recent meta-analysis is saying that we could have going to 30%, 27% of people with diagnosis of cancer, diagnosis of depression. And so this escalating trend, globally, is bringing some attention and a global concern. And then we're beginning to say, well, the mental health professionals, mental health should be, integrated with, oncology, that is the people involved with the treatment of cancer. So there should be a cooperation. I say no wonder that, MDoc has really, they preempted this one, and they've been working on the emotional wellness. Really, this is really one of the plus for the MDoc program, the emotional wellness for people with various physical, conditions, not only cancer, but other conditions. So I say thumbs up for MDoc. Okay, so let's go to the next slide. How do you know when you might be anxious? We're now zeroing down on anxiety and depression as a disorder, so because let's leave the other diagnoses that are possible. The other diagnoses that are possible, that are some other mental health conditions that individuals are prone to, vulnerable to. They've probably had, some before, some psychotic episode, adjustment disorder, which, the episode of diagnosis of cancer may now bring on as a relapse. So we leave and put up, but those common ones like anxiety and depression, we must be familiar with this, and that's what we are going to focus on this talk. So what does it feel to be anxious, to have anxiety as a disorder, not just being anxious? Everybody can be anxious. But what could make somebody to feel that, wow, I hope I'm not having anxiety disorders? Number one, the first thing is constant worrying thoughts. Often, it's reasonable, is concerned about his diagnosis, but there's a level when we begin to look at even those constant worrying thoughts about the diagnosis, and we say, no, this is beyond the normal worrying, and then this is going to the realm of a disorder as anxiety. Sometimes could also be worrying about the treatments, that you're just preoccupied, always talking about it. It takes all the times of your day talking about and thinking about it. And sometimes it's about fear, of the worst. It's like fearing the worst prognosis. And that's why sometimes even the managing physicians may be cautious about what I tell this person, because it appears to be so. And at such point, it's not about not telling the individual, but also co-managing the anxiety issue with it, because the individual should have information at the end of the day. It could also include, being aware of our heartbeat, which is not something that's been happening before. The individual is what we call palpitation. The individual just all the times as if his heart is beating away, as if he's doing vigorous exercise. Even while at rest, the individual might have, these tensions and pains in the muscles, inability to relax, giving rise to musculoskeletal pain all over the body, apart from even the pains related to the diagnosed condition, and the inability to relax, sweating, excessive sweating, breathing too fast, sometimes dizziness, feeling dizziness without, not particularly related to even the illness. And so this could be new things coming on, and it could even be as common as having indigestions and diarrhea, frequent watery stool. This could just, show or suggest that this person is having some anxiety issues. And so, how about depression? Depression is close to anxiety, but it's on another dimension. By the time somebody starts feeling unhappy, unhappiness that will not go away, even when he's given a good news about other aspects of his life, it doesn't really affect it, and it's always there all the time. And then losing interest, in previous pleasurable activities, sometimes it could be like feeling of tiredness, which could not really be explained by the level and the stage of the illness the person has. And then even in anything. So these are some of the things that may suggest to the individual, I hope I'm not getting depressed. And that's really the purpose of this talk. And sometimes it could be, finding it difficult to make simple decisions, making up our mind on things to do. And they're feeling restless, feeling agitated, loss of appetite. Some people, when they're actually depressed, they may actually have greater appetite and they eat more and they even put on weight. That's another dimension of depression. But so that one of the commonest thing again is sleeplessness. Having difficulty with sleep. It's other issue of waking up earlier than usual time of waking up. I'm bringing this so that it should sensitize us to knowing spotting depression as an illness. Sometimes it could be feeling of inadequacy, feeling hopeless about ourselves, feeling guilty about the past, blaming ourselves for things we are not responsible for. All these things put together. And the ultimate of this is when somebody begins to think that life is worthless, there's nothing to live for again, and beginning to think about ending his life. Actually, those are some of the high points of depression as a disorder. And then sometimes, some of these symptoms I've talked about, either in the anxiety side or depression, could really be, we may confuse them with symptoms of the original illness. And so we may not attribute them to, depression as a mental health issues, but no, they are different. The tiredness we feel, with the illness, the diagnosis of it. In fact, not only diagnosis of cancer now, any other condition, diabetes and other, medical conditions. But we know that the tone of the tiredness in this, that when it comes to depression associated with the sadness feeling, hopelessness, loss of interest, really brings out that this is a different thing we are talking about. This is to sensitize us really. So let's look at the next slide. Why are depression and anxiety more common to happen when we have serious physical illness? The first thing is we talk about is to say, well, the stress of any physical health condition is like any stressors in the world which could precipitate anxiety or depression. But apart from that, even the treatment of the condition itself could actually be the factor bringing on the depression or the anxiety. We know about treatments, maybe even talk about treatments for high blood pressure. There are drugs used for high blood pressure that can actually, on their own, because of their
Hi, Dr. Timothy. We have 5 minutes more, and the volume keeps going low. So I don't know. Yeah, so we're struggling to hear.
Wow, sorry about that. Is it better now?
Yes, it is, sir.
Okay, maybe I need to put the mic close to my mouth. Sorry about that. So what I just said, so far, that why do people with serious physical health problem have problems with mental health? Number one, it could be the effect, like just a reaction to the condition, emotional, psychological reaction. I mean, nobody wants to be ill. The number two is the direct effect of the physical condition on the brain. Any physical condition can have direct effect on the brain. And when the brain is affected, that could be mental health issue, because mental health conditions are conditions arising from the brain. And it may not be the condition itself, it could be the treatment, the drugs applied. For instance, we do know that people that use steroids for other conditions, even some medication used, in the treatment of cancer, could directly cause, symptoms of depression and anxiety and other organic mental health issues. So these are some of the ways in which physical conditions can give rise to mental health issues. And then the fourth point is that there could be coincidence. Mental health conditions are common in the society. So there could be coincidence of both the physical health condition and without any particular link in between them. So, but some individuals, the next slide now, could be that because they are vulnerable to anxiety or depression, they might have the tendency to develop mental health problems, because they've had it before or something even before the physical conditions came on. And then we also know, no apologies really. We know female genders also who have some, predisposition to depression and anxiety higher than the male gender. Then we also do know that, there could be other life issues that, are co-occurring with this physical health diagnosis. It could be redundancy, divorce, death of loved one, bereavement, and all this. So this could be factors coming together to precipitate a mental health problem on somebody who has a physical condition. And in fact, also the pain of the physical condition, and then especially when the illness is life-threatening, could actually be one of the pathway why people with serious physical health problem could develop mental health problem, especially anxiety and depression. So now to really go faster now, but there are times when the individual with physical health problem could be more vulnerable, especially when the diagnosis is first made. As I mentioned earlier, the first 6 months of diagnosis is really a critical time that the individual should be monitored closely for mental health issues, the first 6 months. That's what research tells us. And apart from that, even also when there is recurrence of illness, maybe an illness has come, they think there's some remission, and then the illness appears to be coming back, or is becoming more serious and whatever, and is becoming life-threatening. So all these conditions could make an individual. So when should an individual seek help? I think those are the points where we must really round up with now. When these symptoms of anxiety or depression, some of the points I've mentioned before, is getting, worse, and it's getting unabating, and, it's not getting better. And at such point, it's beginning to affect our interests, our work, and all those areas. So at that time, we need, we need to seek help. In fact, noticing these symptoms in the first instance, we should inform the practitioners that are treating us. But more so when there is worsening of these symptoms, or is beginning to affect our functioning, then we must really seek help. And then what sort of help is available for anxiety and depression? We're just using these as examples of the commonest example of mental health problems. Yes, there are talking, treatments, and it depends also on the severity of the condition. One may need to be placed on medication, and we have our family doctors, our trained counselors, psychotherapists, clinical psychologists, and psychiatrists that can help us even to look into the treatment of mental health condition if they develop along with our physical health problem. So what are the ingredients of the talking treatment? Is just about having a trusting relationship with a therapist, opportunity to talk about the problem, and also lending us skills and coping methods, how to cope with our worrying thoughts, our bad feelings, and sometimes even with practical problems. And then so these are the therapists will be able to guide us. So how do we help ourselves? Number one, the first thing we mention is about seeking professional help. If we begin to notice all these symptoms we've mentioned, the first thing is to tell it to even the people providing the treatment for the physical problem. Share your fears and your concern with people close to you, and then they might be able to help you and support you to talk to the doctor that is treating you for the physical illness. I mean, when you mention it, the doctor is able to put two and two together and say, oh, that may be a depression. And that's why we are talking about the integration, the coming together of mental health team and the physicians, managing your condition. Other things that really could help is, number one, you need to comply with your treatments, and then, eating balanced diet that cannot be overemphasized, and then not giving up, to the illness. Oh, there is a code which I give people. I say, don't participate in your illness. Physical problems may come, but sometimes it's not really the physical problem, but the emotional reaction to them that give rise to the problem, to the emotional problems that we eventually develop. So that's why people should not give into the illness. Rather, they should have this attitude of pressing on regardless, while the treatment is going on, and being hopeful also. Then the other point is that to look after yourself, make sure that you build relaxation, pleasurable activities, if possible, as to the extent to which your physical illness can allow physical exercise, into this, and avoid non-prescription substances. People begin to indulge in substances, to make themselves better. Alcohol, for instance, has been known to people get to say, well, let me just drink my sadness away. It does not. Alcohol does not take sadness away. And then try not to worry about, sometimes there could be sleeping disturbance once in a while. Don't begin to build a mountain out of a molehill. Yes, if sleep does not come one day, the following day, don't even bother about it. The following day, sleep will come. But when you begin to sleep worry, that's the worrying, sleep worrying. Oh, I didn't sleep yesterday. I hope I will sleep today. You are actually building the pattern of not being able to sleep the following day. So these are some of the issues. The slides was put together so that we'll be able to have something we can hold as handouts to look through. I mean, we may not be able to go through everything. Then obviously you will need to comply with the instructions of the doctors. Don't be tempted to say, well, let me take more tablets so that it will help faster. No, these are some of the things that will not help. And then when you feel overwhelmed, don't suffer in silence. Talk to someone, talk to your physician, talk to your counselors, and these are the means how you can really, one can help himself. Then finally, the final slide is about how families and friends can help. I mean, many times the individual that has a serious long-term physical problem he sees himself as a bother to family members. I don't want to bug them. I don't want to bug, and it keeps all the problems to themselves. And they don't want to, in fact, when the family members, how are you feeling? Oh, I'm okay. It's as if, well, I'm enough burden to you. Don't let me add more. So family members should continue to feel available, and don't give up. And don't the tendency to say, oh, wow, you are a burden to us. You are becoming burdensome. No, those tendencies should not be shown. at all. And then we need to help them to, we might even be the first people to spot the anxiety and depression and to gently put them to the awareness, oh, you are recently becoming more irritable, you are not smiling as you used to smile before. The feedback should come from family members and caregivers. And that's the way we may, and we say, oh, it's true, but I just didn't want to bother you. Tell us. If you don't tell, and you may even be the people that will help them to inform those that are managing the conditions, So family members should be available and be ready to explore some of this and give feedback to the sufferers, when issues. Then you might even be the one to encourage them to see professionals and to complain about these issues. And it's also helpful to spend time with someone who is anxious or depressed. They don't need to be nagged, but they need to be encouraged and to be talked to. The availability itself may just be the thing that, oh, you have our backing, whatever you are going through. And that may really be what the person needs. And the reassurance. Sometimes the reassurance may have no basis. Don't worry, you'll be okay. Either because, we are exercising faith or anything. But that sense, that word of hope may even be what will be keeping the individual going. And we tell the one thing is, when there is depression or anxiety, there is a link between this feeling of depression and the physical body, the mechanism to fight infections, fight cancer cells. They become depressed when our mind, we are psychologically depressed. It's shown. The phagocytes, the blood cells, that fight infection and those ones, they are weakened. Their hands are weakened, emotionally down. And so these are the things, whatever encouragement you can give the person suffering to lift up their mood and all that, it's actually a positive thing to even augment the effect of the positive effect of the treatment themselves. So as for the caregiver himself, if you're going through, you're getting overburdened by the concerns of caring, you need to also speak out, ask for help. So the caregivers themselves have their own burden, and they should not think that, well, let's discourage. No, you need to also seek help. So caregivers also need to seek help of professionals when they feel overburdened before they get burnout. Thank you very much. That is all I have to speak in this short time. Thank you for listening. There'll be room for questions and we can elaborate on some of the issues we've raised. Okay, thank you
so much. Thank you so much, Dr. Adebowale. It's such a pleasure to hear some of the things that you have said. One of the key things that I've picked up is don't suffer in silence. I know that in the area where we are, there's a lot of stigmatization when it comes to mental and emotional health. But the tables are turning. People are getting more aware. And not just more aware, people are getting more willing to support. And so thank you so much, Sarah, for bringing that up. And we're speaking to everyone on this call. So whether you're a survivor, whether you're your journey, to not go this route on your own. Speak up, speak to your health coaches for as many as within our community. Join our community for as many as are not. And if you're a caregiver to someone who is going through this journey, you're not left out as well. Sometimes you may also feel anxious. It's okay to speak up. It's okay to seek. It's okay, especially with the happenings in this country. I remember this time last year, I think we were buying eggs for 1,000 something or 2,000. Now I think a plate of eggs is about 4,000 naira. So even the country and the evolution that we're going through on its own has the things that it brings. And so the goal of having people around you, nobody is an island. Seek help, seek support, and that's the first step to the recovery journey. That's the first step to coping through this journey. And remember, as many of us are on this call from MDoc, we're rooting for you. We're committed to seeing that you are going through this journey with all the support that you need. So in the spirit of that, we have a number of our community members who would like to share with us some of their stories, their experience. It's such an honor, and we don't take it for granted. It's such an honor that we have them on this call. They have been very, very, very willing to share their stories just as a form of encouragement to as many of us are on this call, to caregivers, to healthcare workers who have joined us today on this special day. It's a day of celebration, and so we're celebrating them as champions, and we're even celebrating them more for not just stopping at being champions, but being able and willing to share their stories with us. So we'll give each of them 5 minutes to share. We will start off with, I think we have Mr. Wale Bamore on the call. I know that I have murdered that name. Sir, please, I don't have money for goats. Forgive me. It's my Igbo tongue that is spoiling the name. So please, sir, thank you so much. I see you on the call. So please go ahead, sir. You have 5 minutes to share with us.
Okay, thank you very much. You actually got the name okay. You didn't bother it at all. So you don't need to seek for any excuse. Thank you very much, madam, and thank you for the Dr. Adewale too. Sorry for the presentation. I've actually gained a lot. This is my second time in participating in this kind of forum. I was here last year too. Actually, I joined MDoc. That was in 2022. Although I started my own career, my treatments of prostate cancer. That was since 2019. And I was referred when I went for treatment in Germany. That was in 2019 to contact you through my Nigerian doctor, Dr. Abolariwa of Lasut. So since then, I've been with you. And, as for the experience, sincerely speaking, my creator for still keeping me up to today, but I can just word on my feeling. So my credit has to go to your team, especially my coach for almost 2 years now, Coach Blessing. And even when she was away, Coach gone back after maternity leave, rather. I think she's back now. These people have been very wonderful to me in the course of my treatment in the past 3 years. And yes, getting my medication as at when it's due, and most importantly, my activities, especially in the area of physical activities and my diet. And it has been a wonderful moment. Just like doctor have noted, I pick a few words, which is one of those things that have been keeping me going. One of that fact is that I communicate. I don't hide my feelings. If I'm not feeling well or having any effects, I'll call Blessing. Most cases, I'll chat with her. And she will respond to say, okay, why don't you call your doctor in Germany or you call the one in Nigeria? So that has kept me going. But of all of, just like the doctor have said, I think it's better for anyone, no matter the condition where you are now. Once it has been detected, any of this form of cancer, mine is prostate cancer, all you need is just make sure you communicate with people. But the only thing is, if we all come from the same background, I will not want. I wasn't telling the side of it say you must communicate to your family or people close to you. That is one thing I've never tried to do, and I know the reason why. Because if your wife has BP and your children are not that too strong, and you are communicating to them, you are feeling pain, they will panic more than you. So sometimes I don't actually bring them into my situation. I would rather talk to my medical doctors and then take well as it is. Because since we all know, especially for the Yorubas, we are always very scared of sickness. And they believe once you have, especially cancer, they believe you will die the second day, or rather you will die within that month. And what I found out in the past 4 years now, that my journey has started with prostate cancer, it's not as easy as it is. People don't drop dead just because of cancer. It's quite unfortunate. I can tell you the past 4 years that I've been battling with prostate cancer, I've lost close to 6 friends who are age mates, university mates, and whatever, who don't even have cancer. So sometimes you just everyone I'm advising you on this day, and you are suffering one form of cancer or the other. It's not the end of life. It's not the end of life. But of course, we deal with a lot of issues emotionally, psychologically, thereabout. But my advice is on them is that just make sure you communicate with people that can really help you. And then I will also flow with the doctor in respect of medication. Don't go for any form of medications. I did it initially and I regretted it. I had effect, but since I've gone off to that, presently the only drug I use now is just the Zytiga, which I got through MDoc connection, and I have the Precitone to step it down. That's all. I don't take Panadol. I've not taken Panadol in the past 3 years. I've not taken any pain relief in the past 3 years. If I feel pain, it's normal. I just take it as it is. So thank you very much, all the teams, members, and the management of MDoc. I really appreciate every one of you. I'm actually on a journey, but I needed to stop by the express to take up this meeting. Thank you very much, ma'am. And thank you again to all the teams, especially my sister, my coach, Blessing. I appreciate you.
Thank you so much, sir. And well done, Coach Blessing. Thank you so much. That's such an encouraging 5 minutes of sharing with us your experience. It's interesting how the mental and emotional health play a very key role in how we function. And so just knowing that you have that support, knowing that you can speak to your doctor, that's the first step. That is the first step. Sharing that. Thank you so much, sir. It's so good to put a face to the name, because sometimes you hear the name and we don't know what the face looks like. So I'm seeing you, yes, for the second. I'm sure I'm happy to see you as well. Okay, so we have with us here the very delectable Mrs. Wuro. Is also not a stranger to this community as well. So please welcome Mrs. Wurola.
Good evening once again, everyone.
Good evening, ma'am.
I'm happy to be here. Okay, I was here last year. My journey started in 2021. I was diagnosed February 2021. And I will say so far so good. The Lord has been faithful. To be diagnosed, like the doctor rightly said, the first few weeks of diagnosis can be very, very traumatic. I bet you I probably was very anxious when I was first diagnosed. But I had that strong belief that, well, what you've seen can be overcome. And I just went on at, okay, what's the next step? After my diagnosis, was like, what was the next step? And it was like, okay, treatment, go into treatment. To be honest with you, the treatment that fed me most after diagnosis was the surgery. And that was the one that really brought me down after, during the treatment. After surgery, I was down for like about 3 months. Because after surgery, I went on to chemo went on with my chemo. But one thing I've learned over in the past 1.5 to 2 years is that if you are diagnosed to have cancer, then it's not like the first speaker said, it's not a death sentence. And one thing I've tried to do in the past 1 year to two is that anyone close to me that have the same diagnosis, I try to be an encourager. I try to like, oh, see, this has happened, and then you can move on. And there's one of my aunts that I always use as a kind of reference point to everyone. I have an aunt, like a church member as well, and she was diagnosed like 29 years ago. What makes me keep remembering was I was pregnant with my first daughter when she was asked, oh, you have a few weeks to live, just come back home from the UK and die. And she's still alive till today. So that's always been my reference point that, oh, if somebody diagnosed with cancer, breast cancer, and is still alive 29 years after, then I can make it as well. And like I said, I was diagnosed with breast cancer in 2021. I went through A2 positive and had 18 cycles of accepting and you know, and add the chemo. But like the doctor said, one thing I did was everybody, all my family members were aware of it. I have two daughters, and like they already for every treatment, for every stage of treatment, for every thing that is going on with me, they know at all times. They know. I tell them. In fact, initially I didn't want to, but I felt like, oh, they needed to know. And I remember one thing my first daughter said, and said, "Mommy, you can't go through this alone. You have to let us know." And I was one day, I was like kind of depressed. I said, "Oh, if this is the end, let it be the end." And she said, "Mommy, don't talk like that. You should think of, yeah, we might think that's a means to an end, but what happens to us?" And I said, and that's kind of prompted me. I said, "Oh wow, even if you are thinking, oh, the pain is much, think of the people around you, and let them and be have a positive mind about it." Also, one thing I've also learned is to know your body, know yourself, know your body. If there are different things happening within your body at each time, you should know, oh, this growth hasn't been there. Sometimes last year, towards the end of last year, I kind of saw there was a kind of swelling on my chest. And the next appointment I had my doctor, I was like, oh, I've seen this swelling. And he said, oh, and he examined, I said, okay, you need to go for biopsy. I went for biopsy. They did a guided biopsy, nothing. I did excision biopsy, and that nothing. I remember the day I was going for the biopsy, the surgeon said, "Oh, are you scared?" I said, "Yes, I'm scared." And it's like you've gone through treatment and you think everything is okay, and then something else comes up and you say, "Oh, is it coming back again?" You know, that fear comes into you as well. But the most important thing is that at any point in time, know your body, know where that whatever different things is coming up, and then you seek answers. One thing I also always do, for every test I take, I try to, once I get my result, I read up, I Google, I read up, and then by the time I'm going to see my doctor, I could ask questions. I know, yes, people say, oh, Google, that's different things, but no, I read to know more, and then so that I to get informed, so that once I go in to see the doctor, I can ask informed questions. And once, because I realize that even the doctors are overwhelmed. There's so many patients. So if you don't ask questions, they can't help you. So I try to read before I see my doctor, and I try to ask questions at every doctor's visit, and move on, and so that can help me. Also, like doctor, I don't. There's so many advice people will give. Oh, take this, do that. Oh, then go to this spiritual home, do that. I try not to listen to such things. I just focus on what I understand and what I need to do, even with my doctor, and what I feel ill. And through my journey, I think I've been blessed. I work with the Federal Ministry of Health, so I have a lot of health professionals around me. And for every point in time I have any queries, I don't hide from anybody. I ask questions. Oh, this is happening. What do you think I need to do? Oh, do this, and then also go to see your doctor. And I think, like I said, I think I've been lucky. I've had a lot of support. I've had people that concern me, and I always remember one thing my extended family says, that, oh, even through this journey, that have made it easier for them because of the strength I've showcased. And that's one thing I think I need to encourage everyone. We should try, and that inner strength we have within us, we should try and use it, because I believe everybody, there's a strength. Don't allow depression to set in. Don't allow anxiety to set in. Yeah, anxiety will come, but like you can always, oh, this means yeah, I'm an overcomer. And like this kind of programs we are having now, I think it's also encouraging in saying that, okay, we look at ourselves as champions, we look at ourselves as overcomers. And I think that's one of the things that has also helped. And also, like the first speaker said, also my coach Chinelo, I don't know how, she's one person I click with. I don't usually click with people on the first go, but Chinelo is one person I've clicked with from onset. Even when she's out of town and she will be on vacation and she links me with somebody else, it's like I can't click with this person. And she comes back and says, "Oh, how have you been?" I said, "I don't know." "Oh, thank God you are back." And you know, it's like, I don't know. I don't know. It's like when God has just pulled somebody together for you, that this is person he wants to be your coach. And I think I just want to use this opportunity to say thank you to her and that I love her. You know, also like I said, we just need to just move on. We just need to take it each day as it comes. Because if we allow, because like the first guy also said, cancer, being diagnosed of cancer doesn't mean the end of life. You can move on. You can move on with everything of you need to do. Sometimes my family feels that, oh, because now I've been diagnosed, I'm an invalid, and then that's one of the struggles we have. No, I'm not an invalid. I'm kind of person that wants to do things for myself, and I still feel I can do things for myself, and I also want to encourage others who are going through this journey that yes, you can overcome. This is like 3 years, okay, yeah, barely 3 years now, but I can tell you, I feel old, I feel well, I feel, yeah, I still have more years to run by. Thank you.
So much. Thank you so much, Mrs. Worola. It's such a pleasure to hear you speak. And yes, many, many more years. If your aunt lived 29, you have to run around so many, many more years. So we have what I think I see Mr. Emmanuel Olajide's hand up. And then I also have, yes, so we'll give you about 3 minutes to share, but let's go with Mr. Emmanuel. I see your hand up. Do you have a question or a comment? Please go ahead and unmute yourself. I think his network is shaky. In the meantime, can we please unmute? If I'm murdering people's names, by the time I finish this, can we please unmute? Can you hear me? Please go ahead.
Yes, I can hear you, Adora. I'm muted. Okay.
Okay. Please go ahead, sir.
Good afternoon, sir. You can go ahead.
Hello.
Yes, sir.
Okay. It's Ogbefun speaking.
Please go ahead, sir.
All right. I'm very happy for this program, and I also commend my two other friends in this journey who have shared their experience. I have been on this journey since 2011. I was diagnosed with prostate cancer in 2011. Gone through chemotherapy, first 2013, 10 sections. Then from 2014 to 2016, every month. And it has been a very turbulent journey. Just like the mental health doctor said, it can be very, very frustrating, especially when you go to the clinic today, you get the lab result and everything, it looks good. But by the time you go in the next 2 or 3 weeks, 1 month, the result is 1 step forward, 10 steps backward. You wonder how you're able to get from the hospital back home. A lot of stress. But the long and short of this journey, what has helped me so far, one, your faith in God, your faith in God, your support base, your family, your friends, your religious background, your church, or whatever religion you belong to, what support do you get from them? That makes the journey a little easier. And I want to also commend the counseling team of MDoc. Coach Adewumi started with me. I think that should be about 2019 or so. Then she left, gave it to Coach Blessing. Blessing has been very fantastic. And she trailed me around the world. I'm talking to you now from South Africa. And she knows that I'm in South Africa. She has been in touch with me at every time. The nutritionist, thank you very much. Please, fellow members of this journey, be very careful of hearsay. Doctors without certificate, be very careful of them. One, any person that advertise supplements to you, if you don't have shoes in your leg, run with bare leg. Run from them, please. They are not helpful. They are death traps. I have lost quite a number of my friends on that journey. Number two, those who preach exclusive natural, be careful, be wary of them. I was almost a victim of exclusive natural some 2 years ago because I was told to take soursop, take it with beans, my or that. I tried to do it as religiously as I could. But when the nutritionist spoke with me, he said, sir, be very careful. Don't allow your body to get used to a particular food. If it gets used to that, it will not take any other one again. That spoke sense to me. And I pulled back. But fortunately, whatever natural thing I was taking, I never missed my medication. I've told myself this Western medication is the best enemy, if at all. I will stick to that first before I see any other angels. So I stopped that exclusive natural and concentrated on my medication. So far, you can see now 2011 to today, that's about 13 years. But God has been faithful. Like the mental health doctor said, you should be your best doctor. Tell yourself. Now, you see, this situation, 2011, I got into it before I got my admission for PhD. While I told some friends that, well, I'll be given admission for PhD. Then you say, hello, PhD is a stressful journey. If you add it to this health challenge, we don't know how you are going to cope with it. I equally had problem with myself. I have a philosophy, there's a proverb in my language that, do people look for cap when there is no head? I don't know where this sickness is taking me to. What am I going to do with PhD? But God started speaking to me, go to your PhD. Go for your PhD. And I have finished the PhD. Within it, I was taking chemo, I've taken all different medication, but I'm still alive today. I'm grateful to God, grateful to the community of friends I belong to, grateful to my family, grateful to MDoc for their counsel. So please, fellow sufferers, don't give up. Cancer is no longer a death sentence. You can overcome. God bless you all.
Thank you. You think it's beast to do PhD? Please, how many of us have PhDs here? So please, we should celebrate him. Oh, celebrate him. Means to finish, to start and finish. I know a lot of people who started and dropped off halfway. Well done, sir. Thank you. One more of our champions who is he's going to share. I think he's having a slight network issue. So we'll move on. Once he joins in, we'll give him the chance. We're going to, at this point, give 5 minutes just to speak on. I know a lot of the speakers mentioned the support that MDOC gives when it comes both for people who are living with cancer, but we understand. So whether it's hypertension, diabetes, obesity. Today. So we're going to have Adeomi. I know you heard Adeomi's name. She's just going to, for 5 minutes, just we've spoken about is, and then we move on. Remember, I have gifts, so please announce winners, and we're going to give out our gifts. So Adeomi, over to you. And once, please alert me once our joins the call again. Thank you.
Thank you. Hello, can everyone hear me?
Yes, we can hear you.
Yes, Adeomi, we can hear you.
Thank you.
We can.
I'll be speaking to the emotional wellness supports that we give at MDOC. Next slide, please. Okay, at MDOC, we see the need for mental health support because cancer affects members.
Hi, Adeomi. I don't know if it's.
Sorry, can you hear me now?
We can hear you. Please go ahead.
Yeah, we can hear you now.
At MDOC, we see the need for mental health support because cancer affects the mental health of patients and cause emotional distress. This happens both after a diagnosis as well as during treatment. Psychological support improves quality of life and adherence to treatment. At MDOC, our emotional wellness team provides counseling, therapy, and emotional support to our members and their caregivers. We support members living with comorbidities like depression and anxiety, as well as hypertension and diabetes, and we provide tailored interventions in all of this. We also provide guidance to build resilience and improve the quality of life of our members. Next slide, please. We work with the primary health coaches and the MDTs, such as the nutritionists and fitness coaches, to provide holistic care for our members through our Complete Health platform. Our Complete Health platform is a user-friendly application. This app serves as a comprehensive health companion, allowing members to effortlessly monitor and track crucial health metrics, and affords them access to our virtual health coaches. At MDOC, our core value
Okay, I think Adeomi is having network issues. I don't know if it's from my end alone. Can we hear her?
Yeah, I think she's having network issues.
Empathy, integrity.
Okay, so we're going to quickly take the part where she was mentioning some of the values through which we do the work that we do. person-centeredness, meaning a lot of the times where we provide support, we try to ensure that it is tailored around the particular member or community member that we are serving. Empathy, it's important that our coaches and the people that serve on our multidisciplinary team also show empathy in their dealings with our community members. Integrity, meaning what they say is what they do. Curiosity, being able to ensure that we are looking at what the evidence is saying. We're curious to find out what your experiences are so that we are better positioned to support you. Respect is very important for us, as we understand that it is necessary that we accord everyone that we serve respect, regardless of their age, regardless of their social, economic class, or whatever distinguishing factors exist. Evidence-based and evidence-generating, meaning in your conversations with your coaches, you feel free to ask them, where is the evidence that supports what you are saying to me? It's important. And we want to be able to develop a community where our members are empowered to be able to ask the questions and seek answers from their coaches. We want to ensure that our work is impact-driven. And the last but not the least is that technology, as we are using today, is an equalizer, meaning we are able to provide things like a complete health app, a complete health web, for you to be able to see your health metrics, track your health metrics. We're listing these things out because we of you have gone through some of our surveys. We want you to tell us where we're doing well and where we are not doing well. In fact, more where we are not doing well, so that we'll continue to improve. Is your coach listening to you when you're your feelings? Are they understanding? Are they empathizing with you? Are they calling you by 5? Are they keeping to their word? Are they giving you respect? Have you experienced anything? To continue to ensure that we're improving the services that we provide, and we're providing you the support to be able to understand your health information, so that when you're able seated in front of your doctors, you're able to ask the right question. I don't know if you like me, if you have family members like mine. I have 1 or 2 people in my family that if they have, even if it's malaria, they go to the hospital, they're given medicine. When you say they don't know, they cannot tell you. What did they give to you? They just gave me medicine. They drank it, but we want to get to the point where you know what your doctor is giving. You're able to ask those questions. Okay, I'm taking 2 every day or 2, right? I might take it before or after a meal. You want to be able to make sure that you're able to ask those your information, your blood glucose levels, your map, and the graph of how your blood pressure has been for the last 1 month. I see that I'm starting another meeting, but thank you so much, sir, for joining us. Please share. I know someone was asking about the right that together and share it across to everyone, and you can read when you need to. The next on the list is our gift. Yes, I told you I came bearing gifts. We have our game, and we have some of our members who would also like to reward an annual celebration. So it's an opportunity for us to reward members. Okay, can you hear me clearly? Just to make sure that my network is not shaky.
It's shaky a bit, but we can hear you.
Yeah, we can hear you.
You can hear me now. The blessing, like I say, the blessing are the troubles of technology. So please let me know if you cannot hear me so that I'm aware. Okay, so we have one of our winners is Mr. Emmanuel Olajide. He's one of our winners. Round of applause. Olajide. We also have Mrs. Wurola Adebayo, who is also one. Put your hands together. She's one of the people that shared her story. We also have Jesu Tofumi. I hope I'm pronouncing that name right. People that was going to get all the things that we were calling out. It's as if I was a bit worried. We also have Taiwo, fourth place. Is he still on the call?
Sorry, can you take that last name again? Taiwo.
Taiwo Olabode. Please be on the call so that I will not move this. And then we have Babajide Modupe as well. It's not easy to win. As each winner is going to get for 1,000 Naira recharge card for their phones. So we're going to so that we can send you the recharge card. It's been a while I've been at a prize giving ceremony. This is the funniest thing I've heard in a while. Olajide, we have a gift for you. You were so active on this particular game. And so we're going to give you a free PSA test. But what state are you in? Are you in Lagos State? Hello, sir. Please unmute if you can. Are you in Lagos State?
Hi, Mr. Olajide, can you hear us?
I think he's trying to unmute.
Hello, okay. I'm in Lagos State, Ogun State.
Okay, you're in Ogun State. Ogun State is not far from Lagos, right?
Yes, we can get across.
Okay, so you can, so we'll arrange, okay, so we'll arrange for you to get a free PSA test on the house. So MDOC is paying for you to get that. Okay? All right, so I think we
Thank you very much. I appreciate you all.
So Mrs. Wurola is in Abuja, as I'm aware. Ma'am, are you still in Abuja? Hi, Mrs.
Yes, I am in Abuja.
Okay, so we can also gift you a free kidney function test.
Wow.
Yes. So for participating in this with us, we will give you a free kidney function test. So please information. So we'll communicate with you through Chinelo, where you can go get it at your convenient time within months. Okay. We'll also get your phone numbers. Remember, I promised us that we're going to get the recharge card. When we contact you, you let us know what network you use. So I'll pause here. Is Reverend John on the call?
I don't think it is. I'm not sure. Emmanuel, can you confirm? Okay, he's not.
Okay, he's not. Okay.
Yes.
All right. So we'll be reaching out to him. He has also gotten one of the is part of our reward program for being able to get on the app. He's been dedicated. He attends all his fitness classes every week. He does not miss his fitness classes. Continue to take responsibility for his health. We'll also like to use this as an encouragement as well. Encourage other people to take their fitness classes, to readings as well. So by popular demand, and because the team has seen I have been summoned and asked, because he was very dedicated to he got the comb, the letter that starts with a C, he brought his ATM card. So I have been asked he should also get another test in addition to that. So sir, we'll be reaching out to you to confirm order me to offer. We will reach out to you, sir, and we'll let you. Can you hear me?
Okay, I think now we can hear you clearly.
I'm so sorry. I think it's about to rain, so it's a bit, the network is shaking. When it's about to rain, it's when our network starts shaking, including our TV stations. So thank you. Just wanted to know if anyone has a question. Okay, I see. Ma'am, you've also been gifted a kidney test, so free kidney. We'll reach out to you as well so that you can, it's important that these are some of the tests that regularly to make sure that everything is okay. So a free kidney function test has been of the game. But I'd like to know, what state are you in, so that we can, we hope that that's the state. Please, can you unmute, ma'am, and tell us what state?
Stage 2.
No, what state are you in? What state?
One.
What state? What state, ma? What state are you connected
Okay.
from?
What state?
Oyo State.
Or your state?
Okay, we'll make something.
Okay, so we'll reach out to you. We'll reach out to you as well.
Okay, thank you.
Yeah, we'll reach out to you and then we can work something out. I don't know if Jesu Tufumi is still on the call.
Yes, she's still on. Jesu Tufumi is still on the call.
Okay. Please, can you let us know what state? Jesu Tufumi. Hello. Hello. I don't know if it's from my end. Can we hear her?
Yeah. Can someone unmute her?
I think she unmuted, but maybe her network is not allowing her. Okay.
Yeah.
So
okay, I think she is.
Okay, can you try again? Try again, just.
Good evening.
Good evening.
Oh, good evening.
So I think this is the first time we're having you here, I believe.
Yes, this is my first time.
I don't know if you heard that you're one of the winners of the game, and we're going to send you airtime.
Oh, yes, I did.
Yes, we're going to
Thank you
send
very
you
much.
double the airtime as a newbie. We'll
Wow.
send you
Thank you very much.
as a newbie, and thank you for joining us today. So a round of applause to everyone. I think I have Babajide Modupe. Is Babajide Modupe still on the call? Can someone unmute?
Hi, Babajide Modupe. You can unmute now. Oh, we also have another newcomer in the chat, Akisoya Oluwakemi.
Okay.
My first time.
Oh, I think the line is breaking a bit. Sorry, can you say that again? Okay, we can't.
Okay, I think it's difficult. Our network is breaking
Can
up.
you
I think it's also
can you type in the chat?
Yes, it's showing this like this is our first time as well, if I'm not mistaken.
Oh, this is our first time?
Yes, I think so.
Yes, please. So, okay, Akinsanya Oluwakemi, I see your message. Absolutely, we'll reach out to you. Someone will chat you up privately now to get your details, and so how you can be a member of our community as well. Okay, so so that we know where you are. Is this your first time of joining us as well? And then time that we promised. So someone will reach out to you. Please do not log off once we're done. We just want to collect your details and make sure that we can. Thank you so much to everyone. I don't know if anyone has any last communication. We are so honored to be part of your journey. We are rooting for you, like I've said multiple times. We definitely want to see you win, and we are solidly behind you. Providing that self-care support. Your caregivers, people that are within your group of support, way train healthcare workers that provide support to you as well to ensure that they're providing you healthcare services. Like we mentioned earlier on, we are MDoc. We have our mobile application. Download our app. Remember, one of the questions that we had in our game was about. So we'd like everyone, it's very easy to download. If you are using an Android phone, just go to your Google Play Store. Apple or iOS platform, we have a web version. So either way, you are still going to be able to access the information. I love giving out gifts, so it was good to be able to give out gifts to those of us who played the seeing Mr. Olajide rushing to go and get the things that we were asking for. It was so refreshing to see. So we have our social. Send us a message, send us an inquiry. Just their material. Please feel free to read them. Feel free to ask your coach questions. Support you on this journey. Just before we go, I don't know if you have any questions, any thoughts. I'll give the floor give any final thoughts. And if you have any questions or any comments, we'll give 1 or 2 people the chance before we call it a good. But okay, on behalf of the team, we want to say a big thank you. Thank you, thank you, thank you for joining. I will see you this time next year. In fact, we will see you this time next year. The only thing that will stop us from seeing, other than that, we will see each and every one of you. Everyone here will be numbered here next year, and we'll have better and bigger stories to tell. Thank you. Evening.